Our next presentation focuses on ultrasound, primarily in liver oncology. Dr. Yuko Kono earned her MD and PhD degrees from Kyoto University School of Medicine, where she also did residencies in geriatric medicine and internal medicine. Following this, she moved to the University of California, San Diego Medical Center, where she's held many different roles. She's currently clinical professor in the departments of radiology and medicine. She has a rich publication history, as well as many major grants, past and present, in multiple imaging modalities. Tonight, she'll present about how ultrasound is delivering exceptional value in liver oncology. Please welcome Dr. Kono.
Thank you very much. Good evening, ladies and gentlemen. It is my great honor to speak to you tonight. So we'll look at some ultrasound images. So the ultrasound technologies has improved a lot. And this is the case, my recent patient with hepatitis C cirrhosis with a liver nodule scanned with Aprio I900. And as you can see, very nice grayscale with a good resolution and good sensitivity in color Doppler. Now, with the ISMI, which is a unique Doppler technology with higher sensitivity, higher spatial resolution, and less artifact, now you can see these small vessels inside of this hypervascular liver lesion. Now, can we diagnose this lesion with these nice images? Unfortunately not. And this is the same thing for CT and MRI. You cannot diagnose liver lesion without the help of contrast. So we'll do this contrast imaging with the CHI mode, which is a contrast-specific imaging. And now with the small dose of this microbubble-based contrast agent injection, you can now see this hypervascular hyperenhancement in arterial phase in this hypoechoic lesion in this liver. Nice thing about ultrasound is because we have high frame rate, we can then go back frame by frame and look at this arterial phase and analyze what is the pattern of enhancement. And it is especially useful when we look at the benign lesions in the liver because they may have different pattern of enhancement. The other important thing to diagnose this liver lesion is to look at the washout. So in this case, you can see this nice hyperenhancement in arterial phase, and in a portovenous phase, 1 minute and 2 minutes, there's no washout. So the lesion is persistently enhancing. And then in a late phase, this case, we had to wait for 5 minutes. Now you can see this late and mild washout. And what is this lesion? This is a CEUS Lilas 5 hepatocellular carcinoma. LILADS, Liver Imaging Reporting and Data System, is a system to standardize technique, terminology, interpretation, and reporting in liver imaging for patients at risk for HCC. It was originally made for CT and MRI diagnosis, and CEUS LILADS was added in 2016. In LILADS, we have 9 different category codes with different probability of malignancy and HCC. And LILADS 1 is the definite benign lesions such as hemangiomas and cysts. And then as the number goes down, the probability of HCC and malignancy will go up. Why it is important? Because HCC is a unique cancer that we would diagnose the HCC when the imaging is conclusive without biopsy. So when we call it LILADS 5, which is almost 100% specific to HCC, we would send the patient to resection, liver transplant, or chemotherapy without biopsy. On the other hand, LILADS M is a lesion that is probably or definitely malignant, but not necessarily HCC. That includes cholangiocarcinoma, metastasis, and some HCCs, especially poorly differentiated HCC, may fall into this category. Now, because of that, LILADS M needs to be biopsied, and we will have a diagnosis. And how can contrast ultrasound differentiate HCC and cholangiocarcinoma? This is a theoretical time intensity curve with the x-axis is time after contrast injection, and the y-axis is the enhancement. So liver will enhance and slowly decline the enhancement. HCC will enhance in arterial phase and then washes out, but in a late and a mild manner. So definition is after 60 seconds after contrast injection, but many HCC will not wash out until 3, 4, even 5 or 6 minutes. So we need to kind of keep watching to look at this mild washout. On the other hand, Lilas M or cholangiocarcinoma or metastasis typically enhances in arterial phase and then washes out very quickly, less than 60 seconds after injection, and also to the marked degree, so it becomes like a black hole or punched out washout. So this is a cholangiocarcinoma case with a heterogeneous arterial phase hyperenhancement, and by 30 seconds, it's already washing out. And you can see 1 minute, 2 minutes, it becomes really marked washout. So that's how we differentiate HCC versus cholangiocarcinoma in contrast-enhanced ultrasound. Now let's look at this very nice case with, from Dr. Stephanie Wilson. There are 2 liver nodules with necrotic area inside, and you can see this nice rim enhancement in these nodules. And in front of your eyes, now you can already see this rim enhancement, it starts washing out. So that's a typical pattern of metastasis. So you can see this nice arterial phase rim enhancement and early washout and marked washout in the late phase. And because of this, contrast-enhanced ultrasound is really useful for detection, also for the metastasis, not only characterization. Now let's go back to this HCC case. So on the left side, this is a normal or regular CHI mode with nice hyperenhancement. This is usually like 9 frames per second or so. Now in the middle, we have this high frame rate scan with 32 frames per second, and I'll show you why we are doing this in a little bit. And on the right side, this is the ISMI that I showed you at the beginning with microflow imaging, which is a maximum intensity hold. And now you can see these small vessels inside of this lesion very nicely. The other thing we can do with microbubbles are that we can talk to microbubbles. So in a regular CHI mode or contrast mode, we intentionally lower MI, mechanical index, so that we gently resonate bubbles and not destroy bubbles. However, you can intentionally destroy bubbles like this flash replenishment mode. So you can destroy bubbles from your scanning plane instantly, and then you can see the inflow again, like repeating a bolus injection without injection again. So when you want to look at the arterial phase again, we can do this technique. Now, this is a new mode in Aprio I series. It's called CVI, contrast vector imaging. So we start with this high frame rate contrast image, and we track these tiny bubbles in this tumor. And they will analyze this bubble movement, and you can get all this parametric imaging, such as arrival time. This is the direction center. Basically, the red vessels are coming into the tumor center, and the blue is going out from the center. And on the right side, this is a velocity mode. And CBI has 7 color overlay type: arrival time, direction, velocity, direction center, velocity variance, trace, and arrow with trace. So this is fairly new, and we are trying to use it, how useful it can be in the diagnosis of liver lesions. So this is a HCC case and cholangiocarcinoma case with different this color display with arrival time, direction center, and velocity. So to summarize, ultrasound technology has advanced with better detection of small and slow blood vessels, CEUS enables characterization and diagnosis of focal liver lesions. CEUS LIRAS is the standardized system for the diagnosis of HCC on at-risk patients. And new CEUS mode with the CVI contrast vector imaging has potential to provide new information on tumor vascularity and cancer diagnosis. Thank you so much for your attention.